This event is really important because it brings policy into practice. It brings people together to really discuss what needs to happen. So you have those people working with patients, on the ground. You have the system leaders, you have pharma companies here as well. And they can have those open and honest discussions as to where are we now? What do we need to do to really change, make a shift?
One of the key highlights has been the discussion around lung cancer screening. And of course, this has a direct impact upon primary care in terms of us identifying patients, but also the outcomes and the way that the outcomes go counter to the normal deprivation gradient.
There was an interactive discussion around genomics and the new things that are coming out. And it was an opportunity to talk to people who are actually in that field and answer questions or even ask questions about what can we do within our area to embed genomics into our pathways better.
To be able to meet with all the different sectors of the cancer system. So we have lots of representation for cancer alliances here, from ICBs, as well as chief executives from big providers.
For Bayer to partner with HSJ on this event, it's really important because it allows us to work alongside industry and NHS colleagues. And also, we've got our own expertise to share in terms of the work that Bayer have done to improve care for cancer patients across the country. So it's that two-way relationship.
How the NHS can work with the private sector on the innovation side, obviously, it's very key in terms of being able to develop those new treatments or new pathways quickly so we can contribute to that improvement in survival.
Inequality, I think there is different patches in the United Kingdom that require a different approach in order to expedite earlier diagnosis, treatment, and just access to care in general.
When we have AI that can work at the same level, as consultants, when something is evidenced and proven and already in place, when does it actually become the responsible choice to utilise AI in this kind of pathway?
I think cancer has been very secondary care focused, and we need to think about how we change the front end of the cancer pathway so it's not as resource hungry as it is at the moment.
There's a huge amount of excitement around the opportunity that genomics and biomarkers offers in terms of moving cancer treatment forward, but there's a huge amount of challenge that comes with that in terms of scaling up the systems so that it can do these tests.
I certainly think that industry could sponsor a primary care initiative where we actually have a cancer care GP in every PCN, so that as these patients survive cancer or they're living with cancer as a chronic disease, there is provision in primary care for survivorship. A forum like this where we've got cancer leaders present from alliances, from ICBs, leading clinicians in the field and pharma together really gives us that great diversity of information that we can use to make the best of the resources that we've got.